Welcome everyone to today's webinar on psychosocial factors and functional outcomes following physical therapy. I'm Andrew Keneally, WCRI's Communications Director. Before we dive into the presentation, I'd like to take a moment to briefly introduce WCRI to those who may not be familiar with our work. WCRI is an independent, not-for-profit research organization providing high-quality, objective information about public policy issues involving workers' compensation systems. We serve as a resource for public officials and stakeholders, but we do not make recommendations or take positions. Studies are peer-reviewed with a focus on benefit delivery system, and we enjoy diverse membership support, including government agencies, employers, insurers, labor unions, service providers, and many others. And it is at this time we'd like to thank our members who are on today's call. Without your support, we would not be able to publish research like this and have events to share it as we're doing today. So we want to thank you. And for those who aren't members, we invite you to explore the many benefits of membership on our website. Now today's webinar, it is 30 minutes long, consisting of 20 minutes of presentation, followed by 10 minutes for your questions. To submit a question, use the questions box located on the right-hand side of your screen. There's a toolbox there. And if you are having issues with your connection or audio, please talk to your IT department, or you can contact GoToWebinar at the number on the screen. A copy of the slides can be downloaded under the handouts on the right-hand side of your screen. Again, the same toolbox. Today's presentation is being recorded and will be provided within 24 hours. So if you miss anything, don't worry, right? We'll send you the recording as well as the slides. And at the end of the webinar, we ask that you take a short online survey. For every completed survey that we receive, WCRI will donate $2 to Kids Chance, which is a great organization that provides educational opportunities to children whose parents were either seriously injured or killed on the job. Now today, as I said, we're going to be talking about our study, psychosocial factors and functional outcomes following physical therapy, but there are so many other topics that WCRI covers. Here are just a few of them, and you can search these and other topics on our website, and we invite you to do so. Here is your presenter today, as well as the lead author of the study, Dr. Venela Thumala. Venela, how are you today?
I'm good, Andrew. How are you?
I'm doing well. Looking forward to a great presentation.
Thank you, and thank you everyone for joining us today. Today's webinar is going to focus on psychosocial factors and how they influence functional outcomes following physical therapy, with a focus on workers' compensation cases, but we are also going to bring in some insights from non-workers' compensation cases. And here's an outline of what is covered in today's presentation. First, I will briefly explain what we mean by psychosocial factors. Then I will show you how common these factors are among workers' compensation patients that are receiving physical therapy. Next, we will look at differences in prevalence of psychosocial factors by payer type and by patient characteristics. And finally, we will show you how recovery outcomes differ for patients with and without psychosocial risk factors. Now, behavioral health has been an important conversational topic in workers' compensation in recent years. And when you think about behavioral health, and when we asked workers' compensation stakeholders about within behavioral health, what is your main concerns, then the unanimous response was that the presence of psychosocial factors, which act as barriers to recovery following a physical injury, was the most common concern that arises in workers' compensation. And that will be the focus of our study today. Now, there are many other related topics on behavioral health that have been in discussion in recent years, especially PTSD claims, PTSD presumptions, mental health conditions such as anxiety disorders, depressive disorders. These are diagnoses, and they are not the focus of our study. What we are focusing on today is psychosocial risk factors which affect physical injuries, which are the most common injuries that we see in workers' compensation. So what are these psychosocial factors? There is a wide array of psychological characteristics, occupational characteristics, social characteristics that can significantly influence an individual's recovery. And this umbrella of all factors that I just described are called psychosocial risk factors. Now, an important subset of the psychosocial risk factors are psychological or behavioral factors. And these are often called yellow flags and include things such as having poor recovery expectations after an injury, or having fear of pain when one indulges in an activity, pain catastrophizing, negative coping, negative mood. And these yellow flags are modifiable and they are clinically relevant during physical therapy. And these are the focus of our presentation today. Now, psychosocial factors also include workplace factors such as perceived injustice, job dissatisfaction, low supervisor support. If they perceive that, then they're also linked to poorer outcomes, and these are referred to commonly as blue flags. We'll touch on them today, but they are not the focus of today's presentation. There are many other factors such as lack of family or community support system that also fall under the umbrella of psychosocial risk factors. And all these may have implications for recovery, but yellow flags are modifiable within the physical therapy episode of care, and those will be the focus of today's presentation. And before we look at the results, Andrew, can we launch our first poll, please?
All right, Venela, the poll that we are asking the audience about is, how often do you see psychosocial risk factors among injured workers? Is it very often? Is it sometimes? Is it rarely? Or are you not sure? So we're going to give you about a minute to fill that in, maybe less depending upon how quickly people vote. Well, people are quick to vote, right? At this point, we have over 65% have voted. All right, gonna give it a couple more seconds, and then we will close the poll and share the results with everyone. All right, and now we're gonna share the results. Well, Venno, it looks like the clear leader is very often at 71%.
Wonderful. So let's look at what the data shows us. And it is correct. Very often is the right answer. That's what the data shows as well. Now, the information about whether a worker has psychosocial risk factors isn't readily available. And so for the purpose of answering the questions that we'll be answering in today's webinar, we acquired photo data, which helps us understand the extent and impact of psychosocial factors. And these data come from 14,000 outpatient physical therapy practices in the United States. And some of these practices measure psychosocial risk at intake of a physical therapy episode. And this is before recovery occurs. So at the start of treatment, psychosocial risk is assessed. And it is measured using validated screening tools such as the Keel Start Back screening tool, or SPARE tools, which are the screening for pain vulnerability and resilience tool. And the data set also includes information about patient-reported outcomes such as patient satisfaction, functional status assessments, and various other factors that influence our outcome, which is comorbidity, sociodemographics, payer type. And when we show you results for how psychosocial risk factors impact functional outcomes, we control for many of these factors that are available to us. Now, as I said, there are many tools that one could use to assess for psychosocial risk factors. With a tool like Start Back screening tool, it provides you a score and says whether somebody has some psychological barriers or significant psychological barriers. Then there are other tools, which are also short tools, that help you identify specific psychosocial risk factors. SPARE is one such tool, and it helps us identify 3 factors: fear avoidance, negative coping, and negative mood. For instance, to assess negative coping, questions are asked such as whether one can pursue hobbies still, are they able to do household chores, are they confident about managing pain? And questions like this are asked, and if a patient scores more than 60 on a domain, they are considered to have that risk factor. These are short form tools that can be easily assessed, and it is one example, and I will be sharing the results from that tool, but there are many other psychosocial screening tools that are available. So let's look at the answers to our first question. How common are psychosocial risk factors among workers' compensation cases? First, we'll see the results from the start back screening tool, which can be only used for low back cases. So I'm presenting results for low back cases here. Now, the yellow portion of the pie chart shows you the percent of workers' compensation patients that responded to the start back screening tool that had significant psychosocial barriers. So 1 in 3 workers had significant psychosocial barriers, 45% had some psychosocial barriers, and 22% were low risk. And using the start back screening tool for low back pain patients, this data, we were able to see that patients who had high psychosocial barriers had 40% smaller recovery, functional recovery, compared to patients that did not have a risk factor. Now, this is for low back, and it doesn't tell you which specific psychosocial barriers are present. Now, if you look at the SPARE tools, they allow us to see, here I'm showing you data for workers' comp patients that had shoulder injuries. And we see that fear avoidance and negative coping are especially common among workers' compensation cases. And nearly half of workers' compensation shoulder cases had scores over 60 on negative coping domain, and a third had high scores on fear avoidance domain. And these two, the yellow and the light yellow bars, they are the most important factors that are underlying fear of movement, which is important for physical therapy outcomes. And another 8% of workers completing the SPARE tools had high levels of negative mood. This is for shoulders, and we see similar patterns for knee cases as well. The numbers are pretty similar. And if you look at low back cases, then psychosocial risk factors are more common. For example, fear avoidance beliefs are also seen in 50% of the cases, and negative mood prevalence is also slightly higher. Now, many of the workers had high scores or had more than one risk factors. So people could have both fear avoidance and negative coping, or they could have all three. And if you look at shoulder cases, then we see that 27% of shoulder cases had multiple risk factors. That is, they had 2 or all 3 of the risk factors that were assessed. And we see similar number for knee cases as well, and higher number for low back pain cases. 40% of low back pain cases had multiple psychosocial risk factors, compared to 27% in shoulders and knees. Now, so far, we looked at data for workers' compensation. And now we look at whether the prevalence differs for workers' compensation versus non-workers' compensation payers, as well as are there certain groups of workers that have a higher prevalence of psychosocial risk factors. First, if we compare the different payer groups that are seeking physical therapy in these clinics, then we see that workers' compensation shoulder patients, I'm showing you data for shoulders, but we see similar results for knees and low back as well. So workers' compensation shoulder patients were nearly 3 times more likely than private insurance patients and Medicare patients to have multiple psychosocial risk factors. So the number was 27% for workers' compensation, whereas it was 9% for private insurance and Medicare patients. In case of knees and low back pain, instead of 3 times, we see 2 times differences. Now, on the other hand, if we look at some other payer groups like disability eligible Medicare patients or Medicaid patients or auto insurance patients, then the prevalence of psychosocial risk factors in these groups are similar to or sometimes even higher than the workers' compensation patients. And these numbers are not adjusted for payer level differences. The ages for Medicare patients are going to be different from a working age population seen in workers' compensation and private insurance. But we did not adjust for these differences because what I'm showing you here is it represents the characteristics of patients that are covered under different insurance systems in the real world. But even after we adjust for all the factors that are available to us, we continue to see striking differences between workers' compensation and private insurance, the other working age group. For example, these numbers become 20 versus 11, so 2 times the difference, even after we control for age, injury severity, and many other variables that are available to us. Now, if we try to understand what are the different factors that may be contributing to these payer level differences that we see, there's a multitude of factors. There is injury severity, sociodemographics, level of disabling health and comorbidities. With respect to workers' compensation, job demands, financial stressors, or system incentives. And some of these factors may be stronger in workers' compensation and some other groups also, like auto insurance, and may drive the differences in how patients respond about their mood, fear, coping abilities. So there may be many factors, and we cannot tease out the individual contribution of these factors without access to much more data, such as clinical records pertinent all the social and work history factors. But here I just list the many factors that may be contributing to these payer level differences. Now, going back to workers' compensation cases, are there certain patient groups within workers' compensation that have a slightly higher prevalence? Then we see that if we look at it by acuity of the injury, if somebody is seeking physical therapy for acute pain episode for shoulders, then we see that 21% of them had both fear avoidance and negative coping. So they had multiple risk factors. And the number is slightly higher for chronic pain, because when you have chronic pain cases, they have those pre-existing psychosocial risk factors, and some of it could also be through the slow through the evolution from acute pain to chronic pain. Some more people could be developing psychosocial risk factors, so the numbers are slightly higher. And with surgical cases, these are even more serious, so we see even higher rate of psychosocial risk factors. But what this also tells you is that irrespective of whether someone has acute pain, a significant percent is going to have psychosocial risk factors at the start of the injury episode itself. Now, another characteristic is pre-existing mental health comorbidities. So patients that reported that they had prior treatment for anxiety, depression, and sleep dysfunction had higher prevalence of psychosocial risk factors than workers who did not have these pre-existing comorbidities. For instance, patients with prior depression had 37% of them had both fear avoidance and negative coping, compared to 24% of people that were not previously treated for depression. With respect to age, we see that workers over 40 had slightly higher prevalence of psychosocial risk factors compared to workers under 40. So far, we looked at prevalence of psychosocial risk factors. Now we are going to look at the outcomes. Our next question is, how do the presence of these yellow flags, what do they mean for recovery? And before I show you the results, Andrew, can we launch our second poll, please?
Yes, we can, Venela. So the question we're asking is, which outcome do you think is most affected by psychosocial risk factors? Is it functional recovery, return to work timing, treatment duration or intensity, or all of the above? So we're going to give you about a minute to fill that in if you would, and then we will share the results. All right, looks about 70% have voted. So we're going to close the poll and share the results. So looks like the clear leader was all of the above at 83%, Venela.
Wonderful. So I don't have results to show you for all of those outcomes, but if we look at functional recovery, we see that when we adjust for all differences between people with multiple risk factors and people with no risk factors, we see that the regression adjusted results indicate that workers' comp patients with all three risk factors had 33 to 66% smaller functional improvements compared to people without any risk factors. And similar patterns are seen for all three body parts with low back pain, slightly psychosocial risk factors are somewhat more prevalent and also have a stronger impact on recovery. And here I share data for workers' compensation. We see similar patterns for non-workers' compensation patients as well. And all these differences are both statistically and clinically meaningful. And if you, I'm saying if people have all three factors or two factors, here are the results. But do each of these factors individually contribute to worse outcomes? Then the answer is yes. All three factors, fear avoidance, negative coping, and negative mood, are each independently associated with smaller functional improvements, meaning presence of any of these risk factors affects outcomes. And while we don't have results for how yellow flags impact return to work outcomes, some of our earliest studies do offer insights into how the blue flags, such as fear of being fired, job dissatisfaction, perceived lack of supervisor trust, which are very prevalent in workers with injuries, can affect both physical recovery as well as return to work outcomes. We found that workers who were fearful of being fired after they were injured had smaller recoveries, longer disability duration, and a much less percent of them were working 3 years after the injury compared to workers who were not fearful of being fired. So blue flags also had a pretty strong effect on outcomes, I would say association. They are pretty strong predictors of outcomes. So far, we talked about, we have shown you that psychosocial factors are common and they are also associated with worse worker outcomes. Now, so what to do with this information is that most studies have demonstrated that addressing these modifiable psychosocial risk factors early after an injury results in improved outcomes. And here's examples of if a person has a specific risk factor, what are the examples of treatments that are available to them? A lot of it is centered around communication, about if coordination of care. For example, if somebody has really elevated psychosocial risk factors, then to consider treatments such as work-focused cognitive behavioral therapy. So in conclusion, there are two takeaways from today's webinar. One is that the prevalence is high. Somewhere between a third to more than half of workers, depending on the body part and the psychosocial risk factors, had it. And while it's true that peers, workers across, patients across all peers had psychosocial risk factors, the risk factors are much more elevated in workers' compensation compared to private insurance. And they have important impact on outcomes. For example, we found that if workers had all three psychosocial risk factors, then their functional recovery was 33 to 66% smaller than in patients that did not have these risk factors, and depending on the body part. And this reinforces that overall health is a function of a complex interplay between not just the biological characteristics of the injury, but also psychological and social factors that impact an individual. With that, I conclude my presentation, and I am going to throw it back to Andrew.
Great, thank you, Venela, for such an informative presentation. Just real quick, because I want to jump into the questions, I invite you all who are on today's call to start putting your questions into the toolbox on the right-hand side of the screen. Just real quickly, questions about the findings, you can email us at wcri@wcri.net.org. Study discussed today may be downloaded from our website, free for members and available to non-members for a fee. Again, thank you to our members who are on today's call. For those who are not members and are interested in membership, please check out our website. Annual conference coming up March 3rd and 4th in Boston. If you don't know too much about it, please check it out. We have 2 amazing keynote speakers, dynamic panels, several sessions featuring original research that only WCRI can provide, as well as ample networking. So we hope to see you in Boston in about 2 months. Lastly, follow us on social media to keep another way for you to keep up to speed with our latest events and research. And lastly, when you exit this webinar, if you have to take off early, please take the survey that pops up. So our first question is from Sam. Why are psychosocial risk factors more common in workers' compensation than other payers?
Great question. Thank you. And unfortunately, we cannot tease out exactly what factors contribute to the differences between payers. But when we control for what one expects, such as injury severity and age, then we see that the differences shrink, but they still exist. And workers' compensation is unique in that there are indemnity benefits involved. And so there may be some financial incentives that come into play to explain some of these differences, but yeah, we don't have a concrete answer for that from the study.
Great. Our next question comes from Timothy. Is there data on how psychosocial risk factors have changed over time? Has their prevalence increased or decreased?
Great question again. As we were doing the study, we wanted to see if COVID had an effect on that. So we looked at some of the pre-post, to see if there are any meaningful trends, and we did not see any. So psychosocial risk factors were in a similar, we didn't see any increase in the prevalence of psychosocial risk factors.
Got some good questions coming in.
Between 2017 to 2024, that's the study period I'm talking about. So if we look 20 years back, I don't know the answer.
Very good. We got some good questions coming in. Next question comes from Tate. Do you know if comorbidities like anxiety and depression were addressed or unaddressed? Not as part of the study, of course, but the injured workers, PCP, for instance?
Great question. So there is a question that's asked at intake about anxiety and depression and where they treated for it previously. But we don't know whether that's something as a part of the claim, the workers' compensation specific injury, like the current injury or a previous injury. So to what extent was something done to manage both the psychosocial risk factors and if any mental health conditions that the patient has, that information is not available.
Okay, our next question comes from Sarah. It's a 2-part question. Are there negative consequences to identifying these factors and potentially expanding the scope of the claim? And if so, does the ability to better manage the claim offset that risk / those costs? Is there any data about that?
Great questions. And so I'm going to, I don't think that I am the right person to answer some of it, but considering you asked me whether there's data on that, so I think I could answer that part of it. actually. Could you repeat the first part of the
Sure.
question?
Are there negative consequences to identifying these factors and potentially expanding the scope of the claim? And if so, does the ability to better manage the claim offset that risk / those costs? Is there any data about that?
Okay, so it's within our data, right? Like if you look at the start back screening tool, you see that 45% had some psychological barriers and 33% had high psychological barriers. So it seems that psychological barriers are something that everybody has. It's just that to what extent are they? Are they passing certain thresholds that have been clinically established or like research has supported to say if it's only this much, then it materially matters to outcomes. So focusing on the ones that have elevated risk factors using validated screening tools probably would be an approach. Otherwise, everybody might seem like they have psychosocial risk factors. That's something that we can answer based on the data that we looked at. But how, whether and to what extent they might have an impact on extending the life of a claim, that's something that we haven't unfortunately examined in this study.
Great. Next question comes from Daniel. Apologies if I missed this, but was there any discussion around interventions such as CBT or other treatments that have been shown to improve overall outcomes and reduce the risk of delayed recovery?
A great point. And I very quickly touched on this because we didn't have the data available to assess the impact of the interventions as a part of this line of research yet. But there are several studies that we cite in our paper that have examined that question. And work-focused cognitive behavioral therapy is one approach. Psychologically informed physical therapy is another term that's used, wherein we found some literature about how interventions such as that have shown early interventions have shown an impact on improved outcomes.
Our next question comes from Kate. How do you distinguish psychosocial risk factors from pre-existing mental health conditions?
Great point. If the psychosocial risk factor is such a broad term, and other than these yellow flags, there are also pre-existing comorbidities, mental health comorbidities specifically, that are also considered psychosocial risk factors. And with this particular, if I provide the example of what clinics that are participating in photo are doing, they both screen for psychosocial risk factors, but they also ask these questions about pre-existing comorbidities separately to be able to assess which one is more important for predicting the outcomes.
Great. Looks like we have time for one more question. This question comes from Sam. What should we do differently based on these findings?
Thank you. We don't make recommendations typically, but I'm thinking that sounds like an implication to me. And the implications of these findings and the literature review that we have done is that psychosocial risk factors, especially the yellow flags, are modifiable and measurable using well-validated screening tools. So early measurement as well as early addressing of any really elevated risk factors has been shown to be impactful in affecting worker outcomes.
Well, great. Well, unfortunately, that's all the time we have today. I want to thank Venela for a truly informative presentation on a very interesting topic. And we obviously want to thank you, our audience, for joining us today. We hope you found today's webinar valuable and will join us on a future webinar, as well as we hope to see you at our conference, again, March 3rd and 4th in Boston. From all of us at WCRI, thank you and have a great day.
Thank you, everyone. Bye-bye.